Okay, I think we're on air. Now. We'll go ahead and start this month's Board of Health meeting, Friday, December 6th at 12:01 p.m. And we will start with roll call.
Jamie Steig,
Here.
Avish Nagpal,
Here.
John Strand,
I am present on the telephone.
Kayla Nelson,
Here.
Lynn Telford,
Here.
Neemal Day, Bernie Dardis,
Here.
Grant Severson, and Jim Capitan.
I am here.
Okay. Next item on the agenda is approval of the agenda. So if you've had a chance to review the agenda, let me know if you would like to make a motion to approve.
I'll make that motion.
I'll second. Okay. Any opposed? All in favor, say aye.
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 Any opposed, nay? Okay, motion carries and the agenda is approved. Next up, we'll be approving the minutes from the meeting on October 11th. If you've had a chance to review those, I'll entertain a motion to approve them.
Madam Chairman, I'd move for approval.
Okay, a second?
Strand seconds.
Okay. All in favor, say aye.
Aye.
Any opposed, same
Aye.
sign. Okay, motion carries and those minutes are approved. Next on the agenda, we have some members or some students from NDSU Public Health, and I will turn the floor over to them. That's just fine.
We're going to get a mic. We have a mic. We have the mic.
What is public health and what has public health accomplished? If you are asked that question by someone on the street, what would you say? Today, we would like to skip through North Dakota history, pulling one major accomplishment from each decade as a way of illustrating that the health of North Dakotans has always been and will remain dependent on a strong public health infrastructure.
Public health in North Dakota preceded everything. We had public health before we had hospitals. We had a public health officer before we were even a state. We had public health services, a congressional appropriation to purchase smallpox vaccines for American Indians in 1832, 57 years before we were even a state in 1889. This is because public health, like public education, is essential to a flourishing society. As you follow our story, imagine the impacts of these historical accomplishments on our lives today.
The 1880s. In the face of diphtheria epidemics devastating children and families, diphtheria antitoxin reduced the case fatality rate from 44% to 18%.
The 1890s. The state hospital was established to provide safe care to people suffering from mental illness. This was 60 years before the breakthrough antipsychotic medication chlorpromazine was created.
In the 1990s, we had the Pure Food and Drug Law. North Dakotians were suffering from adulterated food and medications dumped on them from out-of-state companies. Chemist and NDSU professor Edwin Ladd used his lab to prove it, leading to some of the first food and drug laws in the country.
1910s. The advent of collecting all births and deaths allowed for scientific evaluation of causes of death, in particular maternal and infant and maternal deaths. Over 10 years, State Health Officer Dr. Mason Williams cut maternal mortality in half by the use of data.
1920s. 1925, the Fargo Child Health Projection Demonstration Project, knowing the causes of disease and death, allowed public health leaders to design interventions to prevent them. The Fargo Child Health Demonstration Project was one of four such demonstration projects in the country. It led to the elimination of the smallpox and a reduction of the Fargo infant mortality rate by half.
In the 1930s, there was the 1935 North Dakota Title V Maternal and Child Health Program. As I said, it was established in 1935 under the Social Security Act. North Dakota's Title V Maternal and Child Health Program is the nation's oldest federal-state partnership in this field. Among the many initiatives, vitamin D enriched milk reduced rickets in children.
1940s, we had the 1941 health districts formed. In 1941, North Dakota established 12 health districts with an average of 53,000 people and a requirement of one public health nurse for every 5,000 people. This led to organized public health efforts, including garbage collection, food service inspection, safe drinking water, and mosquito abatement.
In 1954, Salk polio vaccine trials. Polio was endemic throughout the first half of the 20th century, leading to death and permanent disability. In 1954, North Dakota was a Salk polio vaccine trial state. Within 7 years, wild polio was eliminated.
The 1960s. The State Division of Chronic Disease was established in 1964. The blood pressure medication, propranolol, was designed in 1962. The combination of pharmacological and behavioral options for cardiovascular disease prevention drove heart disease mortality from a peak in 1960 to half by 2010.
1970s. In 1974, a network of deep fresh rural water systems was established after reliance on low-quality well water and cistern water. This included treatment and fluoridation of rural water.
In the 1980s, we had the North Dakota Clean Indoor Act. Legislative measures such as the North Dakota Clean Indoor Air Act in 1987 created smoke-free environments in public spaces like restaurants and workplaces. Packets of cigarettes smoked per capita declined by 48% from 1980 to 2020.
1990s, 1996 Women's Way Cancer Funding. In 1996, North Dakota was awarded breast and cervical cancer funding from the CDC called Women's Way. The Women's Way program has screened over 15,000 women with 323 breast cancers and 3,241 cervical cancers detected.
2003, West Nile virus. Emerging infectious diseases, rarely seen in the upper Great Plains, emerged with the first West Nile virus epidemic in 2003. Measures including use of insect repellents, avoiding the outdoors at dusk for elderly persons, and vector control have brought case numbers down.
In 2010's decade, we've focused on opioid response. Starting with STR funding in 2017 and increasing ever since, North Dakota has developed comprehensive community-based approaches to preventing and mitigating opioid-related harm, including safe prescribing, naloxone distribution, stigma reduction, screening, and syringe service programs, resulting in a decline in 2023.
In the 2020s, we have the 2026 New State Laboratory. First established in 1907, the state lab in Grand Forks brought chemistry and technology to bear to protect North Dakotans through testing of water, sewage, blood, urine, and throat cultures. North Dakota is now constructing a $70 million state laboratory on the Capitol grounds in Bismarck.
I hope you have seen the role public health has played in building a healthy North Dakota in the past. Now, we would like to cast a vision for a public health of the future by calling out some of the great public health needs.
Evidence-based public health relying on surveillance, disease reporting, and population health informatics.
Infectious disease control, including hepatitis C, HIV, and syphilis.
Environmental health challenges such as air quality, plastic waste, warming environment, radon, lead poisoning.
Also, improved occupational health, including workplace safety.
Policy measures to reduce substance use disorders, including binge drinking, methamphetamine, and then opioid use.
Collaboration of local public health with FQHCs, quality healthcare, long-term care, faith communities, schools, corrections, etc.
The new generation of public health leaders willing to serve as the public health strategist.
Physical activity and healthy foods such as Strong Towns Fargo Project, farmers markets, and community gardens.
Healthy aging, such as the Stepping on the program.
On behalf of the NDSU Public Health Association, we appreciate the opportunity to attend your board meeting. And we hope that our walk through North Dakota Public Health as history has kindled the flame of pride and confidence in public health in North Dakota. As public health students, we are looking for opportunities to do internships in local public health units in North Dakota. Please consider us when you plan your work.
Finally, we hope that our vision for the future inspires you to recommit yourself to the mission and calling of public health. It is our desire to seek employment in public health, and we seek your guidance as we move ahead professionally. We are your firm supporters and allies, and we are determined to reframe the public narrative about public health in North Dakota. Please feel free to also look at that brochure that is in your packet. It also goes through what we've discussed here today. Again, we are here to be your allies, and we are the future of public health. Thank you.
Public health did it.
Do you have any questions for the students? Hold on. Come back.
Prior to the meeting, I had asked what the area of specialty that you are interested in public health.
You have to go one by one. What are all
So a lot of the different areas, at least at NDSU, we do have the infectious disease management kind of sub-plan, which essentially would be infectious disease control, vaccinations. We also have maternal and child health, which a lot of us here are also a part of that. So that would be prioritizing the health of our mothers as well as infants and adolescents. And then epidemiology is our main degree program, as well as community health.
As a quality leader at Sanford, I know that I have 2 employees that have their master's in public health, so don't forget about the hospitals that have quality departments, because you guys can make a big impact on population health, which is something that's really important. So I was wondering, as you did this project, if there was anything that really stuck out to you as that surprised you from your learning.
I think there are so many things that I didn't even consider. So with the Dr. Ladd doing he was in the chemistry. That really surprised me. And also with the Clean Water Act that we enacted, that was just very eye-opening for me for how much the state does.
When I was a kid, we hauled water from the city, dumped it into our cistern, and that's the water we drank. In 1974, the whole rural landscape changed because of the rural water movement.
I think it was really helpful context for me to remember that public health has been around longer than our hospitals. So that was a really good reminder.
And I did want to add on, I don't think this was mentioned, but there is a subspecialty for American Indian Health too. And it's really interesting what the classes cover. I'm not in that myself, but I love anything related to American Indian Health. It's so important, and so is IHS. So.
Some don't know that in the 1840s, there was a federal allocation for smallpox vaccinations in North Dakota because American Indians were being affected by smallpox that was brought by troops. And so it was one of the first public health initiatives was actually vaccinating tribal people who were suffering from that exposure.
Any questions from anyone else at the table?
Madam Chair, I would have a comment if that is okay.
Yes, please.
This is John Strand. Really great information, and it's terrific to see the role of public health. When you mention future topics, and then you focus in for a moment on American Indian Health, I would put that on the radar front and center. The last I've heard, the lifespan of a Native American in North Dakota, I've heard it's as low as 52. A few years ago, it was 57, I was told, before the pandemic. And to me, that's just a pressing issue for all of us. There are issues that contribute to a lifespan that's 20 years less than mine would expect to be. So just a topic to throw out there.
If there's no other questions, I think that was very well time spent for us. So thank you guys so much for putting that together and coming today. It was a pleasure to have you, and thank you for your passion and commitment to public health.
Thank you.
Can I just make a quick request? There's always echo in this part of the room because of a small delay between somebody who's speaking and the speakers up there. So I was wondering if whoever is speaking can use the dice up here. That might make it easier for everybody else to hear clearly.
I wonder if we get closer to the microphone, if we can hear better. Since our last meeting, there's been other large meetings in here with legislative groups and the commissioners in finance and boards of liquor control have been meeting in here, and it hasn't been an issue. So I was hoping today if we can just use the mics and maybe get closer to them, there's actually less of an echo.
I think, yeah, probably because my voice is going that way. Okay, the next item on the agenda is the health officer report, which I believe, will we go through the slides or we just have the attachment here?
What would you prefer? She regrettably sent us an email yesterday. She was not able to attend today.
Sure. Would the board just prefer to review the slides on your own for the health officer report? Any opposition to that? Okay. Okay, so the health officer report is attached in our packet. Next on the agenda is the strategic plan update.
The strategic plan for FargoCast Public Health was developed in 2022 and is set to expire in 2025. I don't have space now to the microphone. So we had been meeting since October and reviewing the strategic plan to look at the goals and objectives that will be achieved by the end of this year, and then looking forward to how we develop our next strategic plan with stakeholders. Just to highlight the areas of strategic growth that were developed in 2022 to set forward. The original strategic goal number 1 was to diversify and strengthen internal and external communication strategies for FargoCast Public Health. And the objective 1 was to update internal processes for enhanced communication within divisions and across the agency. And with that, there were attempts to include Teams, Microsoft Teams. With that, we have actually created all of the different teams. Our leadership team has a particular channel. Our directors have a channel. We've increased folders for special project collaboration between us with grant opportunities and even special projects outside of our agency, working with the Bloomberg Group and working with homelessness and other collaborations in the community using team channels to organize our conversations so they don't get lost in our emails, etc. Other examples of increased communication have been our all-staff meetings that have been scheduled, our internal quarterly newsletters that have been scheduled and conducted as well. For Objective 1.2, was to update external processes for enhanced communication through media channels and key stakeholders by the end of December 2024. And if you want, I can send this to you so you don't have to feverishly take notes. I didn't create PowerPoint for it, but I can send you, we have a 52-page document that is actually has the sidebar comments that have been tracking since 2022. And then when we have been meeting, we've been updating our notes in there as well from October and through the end of November. Be happy to share that with you. These are just the highlights and not to go through 52 pages of 3 years of comments. But 1.2 is to update external processes for enhanced communication through media channels and key stakeholders. We have completed this, much of the work with our former public health analyst and our PIO team, Holly, right here, had created templates for social media and news releases, and that is to create a consistent theme in how they need to obtain the data that is required or requested for our team members to share on a social media stream, and also for news releases. And even when requests for media come into our agency, it goes through our PIO to coordinate, which has been a great asset for us. We have held an open house for our stakeholders, including legislative members and public members, and that has been done during the Public Health Week last May, I believe it was. And we will continue to look at ways in which we can engage key stakeholders in such activities moving forward. Strategic area 2 was collaboration. Goal number 2 was to identify and pursue strengthened internal and external collaborations. With Objective 2.1 was to implement steps to enhance internal collaboration by December of 2023. There were multiple steps within this objective that were viewed to be completed. Since my arrival 5 months ago, I've seen several opportunities for the departments to collaborate in grant applications. Our WIC department and our nursing department did the most recent collaboration where there was data shared for immunizations, percentages of compliance with that for the ages of 19 months to 35 months. Within our facility, the rate of that is 83%. Our goal is 90%, and Suzanne and Kim worked collaboratively on that, and will continue to pursue that should we be awarded that grant. Nursing, the clinic, emergency preparedness, and administration also collaborated on a grant to work towards vaccine hesitancy, and that was submitted in September. And if we get that or not, it has not yet been actually awarded, and there's information still pending. Even if we don't get that grant, the collaboration between the departments was actually a win, looking at the assets that the departments can share and what they've learned from each other in the process, and knowing that we have the necessary resources in-house to be able to tackle a federal grant application was really quite nice, using all the team members. Objective 2.2 was to implement steps to enhance external collaboration by December of 2024. I have had a brief opportunity to talk with Kathy McKay and Rory Beal, Clay County administrators, regarding the ongoing involvement of Fargo Cass Public Health with the community health assessment, and something I would like to see expanded as well for other engagement. And I'm not sure who's all on that team yet, but I know our former public health analyst had been attending such meetings, and we look forward to re-engaging in the conversation for the community health assessment. Each division has been updating their partner agency lists. Those have been completed. So all of the division directors here have a wealth of partnering throughout our community and our state, actually. So having that is also helpful for us to have at the ready and have them as areas we can collaborate with in future projects. The harm reduction collaboration has been engaging with various coalitions and agencies as well to address the homelessness in the community. And Fargo Cass Public Health has had members from various divisions participating in coalitions and committees throughout the community, and that will continue. So we believe that has been achieved. Strategic area number 3 is workforce, and the goal is to build and support a strong, capable, and committed workforce. Objective 3.1, to provide needed resources to support staff resilience. And there wasn't a particular great marker for this, but we did obtain a workforce grant that can help build on skills that staff believe that they need to have, and we can support them through that. And there's plenty of resources within that workforce grant to help them in areas needed. We've also worked with the Credible Mind platform, which was purchased and is utilized. We'll look at expanding that and involving our Southeast region partners in other counties. We'll be doing a platform demonstration, actually, on how we can have a Southeast region Credible Mind platform. So if there's a county, we participate. I think there are 2 other counties out of the 6 that participate. But if we can get a bundle together, and when counties, then members from those counties look at their Credible Mind assets that they have in their community, if it's regional, they'll have a quicker snapshot to see what all of the assets are in the Southeast region. So inviting our neighbors to that. Objective 3.2 is to engage and support staff in working together toward a shared vision by December 2023. Again, multiple steps were included in this objective. It is overall completed. There's been an increase in staff input solicited. Transparency has increased between levels of leadership. Objectives to collaborate with other departments are being sought through shared work on grants, projects that bring divisions together to serve the community. Objective 3.3 is to enhance workforce recruitment and retention by becoming a preferred workplace in the community by December 2024. Again, we're continually working towards that workforce development grant and utilizing it to help fulfill any of the wishes of our current staff to gain knowledge, training, and keeping them engaged. Strategic Area 4 is policy, and the goal here is to identify and advocate for public health issues requiring systems-level solutions. Objective 4.1 is to enhance the agency's capacity to engage in policy collaborations by 2023. Public health has been engaged in legislative and commission meetings within Q3 and Q4 of this year to discuss areas of concern, specifically the homelessness. Public health in the City of Fargo leadership supported an interim bill for housing throughout the state of North Dakota that has passed through the interim committee and is moving forward for consideration. Objective 4.2 is to increase the awareness among community stakeholders and the public of the impact of public health policy on healthy communities by December 2024. The former public health analyst was attending, again, the community health assessment with Clay County. I would move forward with continuing with those meetings, and we'll work to continue with legislative members regarding the public health needs. There's a public health day coming up February 13th, I believe, 2025 in Bismarck that we'll have members go to. We would look forward to having our division directors or staff from within the divisions that have the expertise speak to public health policies that we'll be tracking as we move forward in this next legislative session. And we'll continue to collaborate with Public Health Department of NDSU and engaging them in expertise. There was a question, for example, that came through from SACHO, and we didn't quite have the answer as to an evidence-based way to pursue community information gatherings and having booths and the evidence of the worth. Is the time spent there worth the effort, basically, of being there? And Professor Strand, actually, I asked the group if I could send it to NDSU for consideration and review, and Professor Strand was able to send back a great answer, which was then shared with the rest of the state, and just utilizing the expertise that we have at the university before it even comes to the field. So a great asset to have in the community. Strategic area number 5 is the health department infrastructure. The goal here is to create a culture supporting continuous improvement of services and overall organizational effectiveness. Objective 5.1 under that is to develop and implement processes to monitor and support implementation of the organizational performance improvement efforts. And we are looking at a demonstration actually later today for a clear impact platform. This platform is something that would allow us to share the data that we have in-house with our public, and it would be online. It's an accountability measure to look at what we're obtaining, the services we're providing, and it's available for our stakeholders to be viewing. And once we are meeting more consistently regarding our quality improvement data and plan, we'll be able to populate that. Again, we would look to see if there's any opportunity for this to be for the Southeast region, not just Fargo-Cass, if there's any way of bundling and having additional pages or tabs created, but it is an effort that we are participating in, and we would like to share our data at the public level. Objective 5.2 is to assure comprehensive, up-to-date agency policies are in place by December 2024. This has been completed, and it's going to be an ongoing practice. And so annually, the policies are reviewed, and if there's anything additionally that needs to be created, for example, then we'll do that in an off-cycle. There are policies that we've identified that we will move with and develop in our leadership team. And having one meeting set aside of our leadership team to designate it towards policy or strategic plan or quality improvement efforts will be part of our 2025 scheduling. With that, that is the end of this particular strategic plan. I believe when looking at this and not having been part of, obviously, the development of it, the team has met kind of the foundation, I think, was to create a more cohesive, collaborative internal workings to enhance the offerings to the community. I believe the team has done that, and looking forward, we would really like to look at collaborating more with the community on larger scale things the community needs and how we can then address them from Fargo-Cass.
Any questions from board members? You and I had talked a while ago about increasing like a community stakeholder group with the healthcare organizations for data sharing. And I think that the community health needs assessment is something that organizations do sometimes for a box check. And it really should be like a living, breathing thing that's happening. So I'm looking forward to seeing what that could do to just further meet those needs rather than just make a document and then 3 years later make another one. So I look forward to what that will bring. And then the platform that you're looking into, anytime we can increase the transparency of data, helps us identify those improvement opportunities. So I think that's a really good, that will be good to see what you guys learned from that. Any other questions?
I just wanted to echo the value of collaboration and working within the community. I think the students' presentation as well highlighted all the areas and opportunities that there are for that. I was curious if you can provide any thoughts on your plan to do the next update to the strategic plan, you know, what that process might look like.
So when I was in the interview process, I had to do what I thought of as to the next 5 years, I think, or 10 years, the landscape of public health. And so when we think about this at a national level, I look at childhood obesity rates, heart disease rates. The Surgeon General had put out loneliness as that epidemic. And those were some of the highlights that I had, and there were others also. And when I think about the strategic planning, and I did an in-house survey as to the first 100 days of my being the director and got feedback from staff. And one of the comments that seemed to resonate was I hadn't shared my vision of where I am leading Fargo-Cass Public Health to go. And really, it wasn't that I was holding back on doing that. It's that it's not my vision where Fargo-Cass should go. It will be a community vision, and I will help to guide us meeting those needs. So when I think about where the strategic plan needs to be, I think I need to have a better community health assessment so that I know what kind of initiatives, or our team knows what kind of initiatives we need to put forth to meet those needs where we can as Fargo-Cass Public Health. And so I think participating in or capturing as much as I can from the community health assessment process where it's at. I've recently just looked at Essentia's community health assessment that I think was from 2023 to 2025 is the assessment date of that one. In seeing where we fit, right? So I think about not just in schools as a multi-tiered systems of support, but also as the triaging and layers of which prevention and promotion fit in healthcare. And so if we are that first level, where do we support in the community, and then where do we start to provide services, and then where does it need to come into hospital care and advanced other clinic care that we don't offer, because we can do the things that others can't. So just trying to see where we fit in the needs that have been identified, and then strategically make the goals to meet them. So it's not a great answer, Jamie, because I don't have a solid vision of where that needs to be, but it is just trying to figure out what the needs are so we know how to tackle that.
Okay. Any other final discussion on the strategic plan? Thank you for reviewing that with us. Okay. Next item on the agenda is the budget update.
And this might be the most boring budget update you've probably ever seen. Mostly because I think we're going to end the year on target, both in expenses and in revenue. In fact, the expenses should come in at 96% of budget for the year, and revenue should hit 100 or more of what we projected for the year, which again then means the general fund portion actually goes down from what we projected. There are some budget adjustments that still need to happen this year. The city finance team will look at our budget. They'll make those adjustments in the next few weeks or even after year end. But the numbers still should come out pretty close to what I've projected here. No surprises really. Our overtime was pretty high this year for harm reduction, but we are higher in the next 6 months than we are currently running right now. So hoping to see those numbers continue to go down. And I don't really have anything that stands out. So if you have any questions on any of those line items, please let me know.
I'm just curious, what were the factors driving overtime? Was it inadequate, like open positions or something? What were some of those factors?
Yeah, a lot of turnover and harm reduction. The other part is in the first part of this year, we were trying to get the budget down, and so we weren't working as many hours. We didn't have some of those programs open, and yet we needed to be open, and so it kind of exploded. And trying to pull that back in, we've been working on for a few months now. So I think we're going in the right direction, but staffing was an issue for quite a while.
What's the temp seasonal budget portion? Is that like For like winter warming and that type of stuff?
That is, most of our staff are in temp seasonal in harm reduction.
Okay.
In all programs. We only have, I think, 20 or so funded, or not funded, but positions in the city of Fargo. The last 2 years, we've requested that numbers of those positions actually become city positions. That keeps getting denied. They gave us the budget for the temp seasonal, but we're trying to move 5, 6, 7 positions every year into the budget. Yeah, we also had a deployment, and so we've also had some temp staff picking up for that. Makes a difference. That's a small part of the whole temp seasonal. Yeah. Any other questions?
Any other questions or discussion on the budget? If not, we can move on to the next agenda item, which is public comment. Do we have anyone's comment? Okay, no public comment. Then the next item on the agenda is approving next year's Board of Health schedule. And I don't know if you want Jen to talk about the quarterly setup maybe? And I can support that because I agreed with you.
Thank you. So when we were, part of this agenda item for December is to schedule, of course, the next year's meetings. And having done quarterly meetings with different boards, I used to go to a Board of Governors and we would do quarterly, but we would complete the quarter and then report it in the next month. So Q1 would be January, February, March, and then we would report on that the first week of April. And it would just kind of fall that way. So we would still have the 4 meetings a year, but it would be the month after the close of that first quarter. And it keeps data consistent so you can track it year over year. And as we'll be presenting different data points. And so it's a tracking system for me to have it quarterly versus every 2-ish months or.
Well, and I think just so the board knows why I supported a change to this this pattern of months, I guess, the quarterly strategy. We had, and Lori might have to help me, we would do May and then not until September. So there'd be this big gap in between meetings. And so I do think that just to keep, to be able to keep standing agenda items, the department report outs, the data, those types of things, I think a quarterly, a month following the quarter makes sense. So that was why I supported that. And so that does add a July meeting back to the calendar, which, Lori, we all know summers are, well, they're short for one. I'm missing it right now. But I thought that one Friday noon meeting during the summer wouldn't be too unachievable, so. But happy to hear any comments from the board.
My only comment is we'll need to make sure we have quorum in July.
That is
was a
true.
challenge in the past, I think, when we had an August meeting.
So we'll see how it goes this year, and if we have to adjust, we can adjust. So following that discussion, I entertain a motion to approve next year's Board of Health schedule. A motion to approve? Any second?
Second.
All of those in favor of approving next year's schedule, please say aye.
Aye.
Any opposed, same sign. Hearing none, motion carries, and next year's schedule is approved. So that means that our next meeting will quickly come in a month on January 10th. So we will see you all back here in a month.